Back at the naturopath from, I'm from Russia. Right, let's talk about autoimmune disease, right? I'm not from Russia, I'm from New Zealand. Just disregard that. I'm on one of those silly days today. Now, many patients I've seen, especially several years ago, were keen on taking Synthroid, or a synthetic T4, a hormone for hypothyroidism or low functioning thyroid. Now, one of the most common autoimmune diseases is Hashimotos thyroiditis. It was discovered, I think, around 1902, 1910 by Dr. Hashimoto from Japan. And Hashimoto's is very, very common. In fact, it's one of the most common causes of low functioning thyroid. But doctors seem to be all hell-bent on giving Synthroid or T4, for this condition. Now, that's okay to a degree, because what's going to happen is that the body's going to break the T4 down, in the liver, in the kidneys. It's going to help to supply the body with the needs for T3 and T4. But the problem is it's doing squat diddly for the autoimmune condition. It's doing nothing. You're basically treading water. Meanwhile, your thyroid is slowly being destroyed by your immune system. Because remember, it's autoimmune disease. So the body's attacking the thyroid. It's not really, Synthroid's doing nothing for the thyroid. I urge you, can you hear me? I urge you all, if you've got Hashimoto's, you've been diagnosed with it, or even if you haven't been, if you've been diagnosed with low functioning thyroid, get your antibodies checked. Please get them checked. Your vitamin D level, ask your doctor to do the thyroid antibody test. It's the TPO, that's the anti-thyroid peroxidase, and the anti-TG, okay, the anti-thyroglobulin. So both of those should be checked. Also, you want to check, hopefully, your iodine, your selenium, and your vitamin D. I'd probably do a zinc taste test as well. Make sure you ask for these tests, because GPs will otherwise not do them for you. Find out why your thyroid is sick. Find out why the immune system is attacking the thyroid. Don't just sit there in the doctor's office and grab a bunch of pills and walk out after 2 minutes. The doctor's not always right. The doctor is always busy. So I don't blame medical doctors. Most medical doctors I know, in fact, probably all of them, are really good people, and they have got a strong desire to help you to get well. Some have got specialist training like me. Many have got no training at all in alternative medicine. So all they'll do is give you a synthetic drug for a symptom. Now, that's okay for them because you're out the door, but it's no good for you, okay? That's what I'm trying to say. You need to really look further than this thing, okay? Look further than your nose. Go deeper into it. I've got a couple of friends with Hashimoto's doing very well because I've got them to do iodine testing, vitamin D testing. We've tweaked a few things and got the levels up, and guess what? They're feeling so much better. The fatigue's going away. They're sleeping better. The pains are going away. It can happen to you, okay? I sound a bit like Krusty the Clown from The Simpsons, don't I? It can happen to you. I like The Simpsons. Now anyway, what was I saying? That's right, do the gamut of tests. Do some Google searches for Hashimoto's and get the tests done properly. Don't just rely on Synthroid. It's going to mean that your thyroid will end up being destroyed in the long term, and you don't want that. Hashimoto's often goes through phases of overactive and underactive. It can be confusing for your doctor and for you, right? This is very common with Hashimoto's. It's not always just low functioning thyroid. It can be high functioning or low functioning, but get the antibodies checked because you need to know if it's autoimmune or non-autoimmune. That's the important thing. If it's non-autoimmune, it's not so bad just staying on Synthroid. But preferably even then, I would recommend you do an iodine test, a 24-hour urine iodine test. Please do that and get the iodine in the sweet spot, and then see what happens. Most people I know with low functioning thyroid have got some issue with some mineral like selenium, iodine, or zinc, or vitamin D. Something like that needs tweaking. It could be you. Okay, remember, look further than that. Thanks for tuning in.